Hi everyone, today we are going to start with a new topic that is sedative and hypnotics. Sedative and hypnotics are drugs that are used to treat insomnia. Insomnia is a condition of the loss of sleep or some sleep related disorders, and the sedative and hypnotic class drug are used to treat the insomnia. Sedative are the drug that substitute the excitement and they causes the sedation without inducing sleep, produce only drowsiness. They are called as sedatives. And hypnotics are the drug that induce and maintain the sleep, like a normal erosible sleep. Means hypnotics are drug that are responsible comparatively for the deep sleep condition, and sedative, those drugs which are sedative in higher dose, they may act as a hypnotics also. And barbiturate and benzodiazepine, these are main drug which are belonging to the class sedative and hypnotics. Um Actually, what is meant by sleep? So sleep, it is divided into the two phases. One is a non REM sleep and another is the REM sleep. Non REM means non rapid eye movement sleep, and REM sleep means rapid eye movement sleep. So non REM sleep, it is divided into the three stages, that is stage 0, stage 1, stage 2 and stage 3. In the stage 0, from lying down to falling asleep, मीन्स हम जब बेड पे जाते हैं तो जल्दी नींद नहीं आती, कुछ टाइम के बाद नींद आती है. सो इट इज़ अ स्टेप बाय स्टेप प्रोसेस. In stage 1, eye movement reduce and muscle get relaxed. In stage 2, there is a little eye movement and subject are easily erasable. Means जो कोई भी पर्सन सोया है उसे हम जगा सकते हैं. एंड इन स्टेज 3, सब्जेक्ट आर नॉट इजीली एरोजेबल. मीन्स हमें हमें उसे जगाने में थोड़ा सा देर लगता है. एंड REM स्लीप, रैपिड आई मोमेंट स्लीप, ड्रीम्स एंड नाइटमेयर्स आर देयर इन द REM स्लीप एंड मार्क मूवमेंट ऑफ द आई. हमें जो सपने आते हैं वो रैपिड आई मूवमेंट स्लीप में आते हैं. सो दिस इज अबाउट द फेजेस ऑफ स्लीप. Then about the classification of the drug that are used to treat the insomnia: barbiturate, benzodiazepine and non-benzodiazepine. These are three main class of the drug used to treat the insomnia. Barbiturate, they are classified as a short acting barbiturate, intermediate acting barbiturate and long acting barbiturate. Short acting barbiturate include thiopentone and methoexytone. Thiopentone is a drug with a sulfur in its structure. Thio indicate the presence of sulfur. And intermediate acting include the two drug, that is secobarbitone and pentobarbitone. Butabarbital also is there in the intermediate acting class. And long acting include mefobarbitone and phenobarbital. Then benzodiazepine, actually benzodiazepine are good sedative and hypnotic, as well as it is with a muscle relaxant property. It is used in the treatment of the epileptic condition also. So only benzodiazepine class drug that is with a muscle relaxant activity is a diazepam. And anticonvulsant include drug like clonazepam, clobazepam, lorazepam and diazepam. Other than this, benzodiazepine class drug, they are classified depending upon their duration of action. Like barbiturate means short acting, intermediate acting and long acting. So in ultra short acting benzodiazepine class drug, triazolam and midazolam, these two drug come under the ultra short acting benzodiazepine. And in short acting, alprazolam, then oxazepam, and in long acting drug, flurazepam, diazepam, nitrazepam, lorazepam. So this is the classification depending upon their duration of action, and here the classification depending upon its application is given. Then non benzodiazepine class drug, means this drug also called as Z drug to treat the insomnia, because the name of all these drugs is starting with letter Z, like zopiclone, S-zopiclone, zolpidem. So this is all about the classification of the sedative and hypnotic drugs. Then next part is about the mechanism of action of barbiturate or benzodiazepine class drug. Barbiturate produce dose dependent action. uh, it is in low dose it is sedative, in comparatively larger dose it is hypnotics, and more than this dose it causes the anesthesia. Both benzodiazepine and barbiturate, this drug bind to the GABA A receptor. GABA A receptor is a ligand gated ion channel type of receptor. It is ionotropic type of receptor, and only the difference is that the binding site of barbiturate is different, their mechanism of action is different, and benzodiazepine binding site is different. Barbiturate bind at a alpha beta interface of the GABA A receptor, and once barbiturate bind, this barbiturate increases the duration for which the GABA mediated chloride channel open. Barbiturate increases the duration for which the chloride channel open, and barbiturate increases the conductance of the chloride channel. And means barbiturate bind to that alpha beta interface, it causes the chloride ion conductance through that channel, it lead to the hyperpolarization, and then it lead to the sedation. Barbiturate also increases the binding of the benzodiazepine class of drug to the GABA A receptor, and so barbiturate are with a GABA mimetic action as well as GABA facilitatory action, because they itself bind with a alpha beta interface, as well as this barbiturate class drug promote the binding of the benzodiazepine also. So they are with both GABA mimetic action and GABA facilitatory action. In this diagram you can see the mechanism of action of both barbiturate and benzodiazepine. uh, uh, Barbiturate are bind to the alpha beta interface, that it is shown with a yellow color, alpha beta interface. To this alpha beta interface barbiturate bind, and alpha gamma interface, it is here shown with a green color and this blue color. To this interface benzodiazepine bind, and once they bind, the chloride channel open, it lead to the hyperpolarization, and it lead to the sedation. And remember the binding site of a GABA is a inhibitory neurotransmitter in our body. uh, GABA binding site is different than the binding site of the barbiturate and benzodiazepine. All these three substances, barbiturate, benzodiazepine and GABA, they lead to the hyperpolarization, but their binding site are different on the this GABA A receptor. This is pentameric structure, alpha beta interface, beta alpha gamma interface, pentameric structure is there, and binding site is different of both drug. Then benzodiazepine class drug, benzodiazepine bind to the alpha gamma interface of the GABA A receptor. Benzodiazepine increases the frequency for which chloride channel open. मीन्स फॉर एग्ज़ाम्पल एक स्टूडेंट है, एक स्टूडेंट को हमने ऐसा कहा कि तुम 2 आवर्स के लिए स्टडी के लिए बैठो और उसके बाद अगले 2 आवर्स के लिए ब्रेक लो, तो उसका स्टडी जो है ना वो प्रॉपर तरह से नहीं हो पाएगा. पर अगर हमने उसे कहा कि तुम 45 मिनट्स कंप्लीट स्टडी करो और 45 मिनट्स के बाद 5 मिनट्स का ब्रेक लो, तो दैट विल बी द प्रॉपर मेथड ऑफ द स्टडी. 45 मिनट्स का स्टडी, उसके बाद 5 मिनट्स का ब्रेक, और उसके बाद अगेन 45 मिनट का स्टडी. मीन्स वी आर इंक्रीजिंग द फ्रिक्वेंसी ऑफ द ब्रेक. Like that benzodiazepine increases the frequency of the opening of the chloride channel. They do not increase the duration for which the chloride channel open, and that's why benzodiazepine are more safer as compared to the barbiturate class drug. Along with this, benzodiazepine act on the midbrain ascending reticular formation. Ascending reticular formation, it is responsible to maintain the wakefulness, and benzodiazepine class drug also control our thoughts. And benzodiazepine also act as a good anticonvulsant, anti-anxiety and muscle relaxant drug. Muscle relaxant, that is a diazepam. Then anticonvulsant, you can remember by the trick, that is the Claude means clonazepam, clobazepam, L indicate lorazepam and D indicate diazepam. So this is about the mechanism of action of the barbiturate and benzodiazepine. Then one thing that benzodiazepine are teratogenic in nature. Teratogenic means those drugs that produce the abnormalities in the child during pregnancy. Benzodiazepine causes the floppy baby syndrome. So this is about mechanism of action of benzodiazepine. Then why benzodiazepine are more preferred as compared to barbiturate? Because low abuse liability. Benzodiazepine are with a high therapeutic index. Therapeutic index is a measure of the safety of the drug. Then barbiturate are enzyme inducer drug. Enzyme inducer are those drug which induces the activity of the enzyme, and once the activity of the enzyme is induced, when an activity of the enzyme is increased, it lead to the rapid degradation of the drug, any drug, by that enzyme, and it lead to reduce the pharmacological effect of that drug. So barbiturate are actually enzyme inducer drug. Then specific antidote flumazenil, it can be used in the benzodiazepine poisoning. uh, there is a no specific antidote for the barbiturate poisoning, but there is a specific antidote for the benzodiazepine poisoning, that is a flumazenil. And benzodiazepine do not cause cardiac arrhythmia, so that's why benzodiazepine are more safe drug as compared to the barbiturates. And next part is a non-benzodiazepine type of hypnotics. Non-benzodiazepine type of hypnotic include zopiclone, S-zopiclone, zalipilone, and zolpidem. Means all drugs are starting with a letter Z. Zopiclone is the first non-benzodiazepine drug. It acts as an agonist on the subtype of the benzodiazepine receptor. Its hypnotic action similar to benzodiazepine and prolongs stage 3 and stage 4 of the REM sleep. Zopiclone do not disturb the sleep architecture. Then S-zopiclone, it is S enantiomer of the zopiclone. S-zopiclone is a longer acting Z drug that is used to treat the insomnia. Then zalipilone, it is a shortest acting non-benzodiazepine drug. And next is a zolpidem. Zolpidem is with a imidazopyridine nucleus, and it causes minimum daytime sedation. And actually in case of the poisoning with a Z drug that are used to treat the insomnia, uh, flumazenil can be used as an antidote in case of the poisoning of such drug. Then next part is about melatonin. Melatonin is a hormone that is produced by the pineal gland, and it maintains the circadian rhythm. Circadian rhythm means a biological clock. हमारा उठने का एक स्पेसिफिक टाइम होता है सुबह में, और रात में सोने का एक स्पेसिफिक टाइम होता है. तो दैट इज़ अ बायोलॉजिकल क्लॉक. एंड सो इसमें मेलाटोनिन का रोल बहुत ही इम्पोर्टेंट होता है. Melatonin receptor agonist, that is Ramilton, it is also used in the sleep onset insomnia. Means sleep onset insomnia means कुछ लोग ऐसे होते हैं कि जो जाते तो है सोने के लिए पर उन्हें जल्दी से नींद नहीं आती. दैट इज मीन्स ड्यूरिंग द onset of the sleep there is a problem, that is the sleep onset insomnia. Then this is about the agonist and inverse agonist. The names of this drug is important, that is mucimol. Mucimol, it is agonist at a GABA site on the GABA A receptor. Means mucimol is a drug that bind to the GABA A receptor exactly at that same position at which the GABA neurotransmitter bind. And beta carbolin is the inverse agonist at a GABA A receptor. Inverse agonist is substance which is with a intrinsic activity -1, and inverse agonist bind to that particular receptor and produce the effect which is opposite to that of its original substrate. That's why it is called as inverse agonist. And beta carbolin is a inverse agonist substance. Mucimol is a agonist substance. Barbiturate and benzodiazepine, they are agonist at a allosteric site, means they are binding with a GABA A receptor actually, but their binding site is different than the GABA neurotransmitter. Means barbiturate bind with a alpha beta interface and benzodiazepine bind at a alpha gamma interface. And bicuculin, it is competitive antagonist of the GABA A receptor. Antagonist means the substance which is with a zero intrinsic activity, and which block the activity of the agonist, which block the pharmacological action that is arise by the agonist drug. This is all about the barbiturate and benzodiazepine class drug. Then one thing in case of the barbiturate class drug, barbiturate class drug, they causes the synergistic action with a CNS depressant drug like alcohol or opioid category drug. They show synergistic action, so that's why they are avoided with other CNS depressant drug. In this chapter, the important part is the classification of barbiturate and benzodiazepine. Depending upon its duration of action, you can write as per their application also. uh, Benzodiazepine, they are classified as a short acting benzodiazepine, that is a um, short acting benzodiazepine, ultra short acting, and long acting benzodiazepine. In long acting, flurazepam, diazepam, nitrazepam, lorazepam are there, and in case of short acting, oxazepam, alprazolam is there. And in case of the ultra short acting, midazolam and triazolam is there. And the name of the Z drug of the insomnia, it is also important. And mechanism of action of the barbiturate and benzodiazepine, means barbiturate 2 hours study और उसके बाद 2 hours का break, means they increases the duration for which the chloride channel open, and benzodiazepine increases the frequency for which the chloride channel open. Both bind with a GABA A receptor. Then benzodiazepine are teratogenic, they causes a floppy baby syndrome. Then this diagram is also important, indicating how the mechanism of action is there. And safety in case of benzodiazepine and barbiturate class drug, and name of this Z drug of the insomnia, and name of the Ramilton, that is the melatonin receptor agonist. It is important. And name of all these drug, mucimol is a agonist at GABA binding site. Then beta carbolin, it is inverse agonist at a GABA A receptor. Barbiturate and benzodiazepine, they bind with the allosteric site. And bicuculin, it is a competitive antagonist of the GABA A receptor.